seeks to empower gender equality and empower all women and girls. Although globally the population of women outnumber the men, gender inequality still persists, whether in business, education, politics, and what have you. In Ghana, there is a low representation of women at decision-making positions. Women continue to endure violence and inadequate access to resources and credit facilities. In most cases, they lack the capacity to pursue their dream. How do we then accelerate the efforts aimed at attaining the SDG 5? Today, we are taking a look at the role of women-led NGOs and traditional leaders in accelerating the SDG 5 in Ghana. My guests for today are Mrs. Cecilia Seno, the Executive Director for Hope for Future Generations, and she is seated on my far left. And I also have Mama Jitri. She is the Queen Mother of Vli, Agoviefe. I hope I got that right. Yeah. You're welcome to our studios today.
Thank you.
So let me start with Mama Jitri. When we talk about women empowerment, from the traditional perspectives, what do we mean?
Okay, thank you for the question. Okay, we mean we have to empower our women to know what it is or building their capacity, so that in education, health-wise, and then financially, we need to talk to them to understand what it is for women to be on their own, so that they will not be lacking. Especially, so we need to educate them always. And luckily, we as traditional leaders, we have this authority. So when we meet always, or we have functions, we talk about it and then educate the women on issues that pertains to them.
Okay, so let me continue with you, Auntie Cecilia. What do you think we have done so far in attaining the SDG 5? I mean, it's not all gloomy, so what do you think the journey has been so far?
Yeah, thank you very much, and good afternoon to your listeners. A lot of women organizations have been struggling to ensure that Ghana also achieve the SDG 5. I think the important thing we have to do is partnership, because no one person can do it. And likely, Hope for Future Generations is the convener for SDG 5 under civil society organizations. And we are working with several NGOs. The problem now we have is that working with the traditional leaders, the community members, the women at the grassroots has not been a good thing. The reason is that resources to get to those people is not there. Empowering the queen mothers who are in charge of social control of our country, who are the role models, who are the voices for the women, have been mobilized. But for them also to get the resources to get to the grassroots is a problem. But if you talk about women empowerment, education is one of the first things that we must consider. Because if you want a woman or women to attain certain level in society, they must be educated, because many people wouldn't like to work with women who are not educated. And so we have achieved quite a lot when it comes to girls' education, because if you know the number of girls who are in school and number of boys who are in school, the challenge is that many girls don't make it to the tertiary. They start and then the number reduces until tertiary. So you get fewer girls entering tertiary and more men or more boys going to getting to tertiary. So I think that is it. When it comes to health, we still have challenges with maternal mortality. We have very high teenage pregnancy. The research report that came out, really, all the regions of Ghana have issues of teenage pregnancy. So if our girls are pregnant, how can they go to school? How can they be empowered to take decision, participate in decision making at the highest level of society? I think we still have challenges because focus, resources to address, to implement the SDGs is inadequate. Partnership with civil society is important. Partnership with traditional leaders, because they have the power to take charge of community issues of their subjects. And we talk a lot about their partnership, but the real partnership that will empower them to lead that discussion is inadequate.
So does that mean that governments over the years have not been forthcoming with pursuing this goal?
Government at their level, they are doing their best. I will not say they are not pursuing it. I know all the ministries are supposed to integrate SDGs into their annual work plan or develop. We are all working within the national development plans. The important thing is stronger civil society partnership. You know, we all have our niche, we all have our strength. Engaging communities is the work of civil society organizations. And if I talk about CSO organizations, I'm talking of traditional leaders, the queen mothers, the chiefs, women groups, faith-based organizations. See the number of women who go to our churches every day. 24 hours they are in church. And those are low-hanging fruits that we must use to empower them. Many of them know what to do, but the resources is what is not there. But the government is doing their best, but they can do more than what they are doing.
So, Mama Jitri, I mean, before the CSOs can get to the women at the grassroots to even empower them, you are rather closer to them. I mean, when you interact with them, what are some of their needs that still remain to be addressed?
Actually, the needs are many. Because, like, okay, there are some places as traditional areas who maybe the traditional leaders are empowered. They have resources in their various communities. But like in our areas, there is nothing like that for the leaders to stand on. Hence, it still boils down for support from maybe the NGOs or the government to help us to empower the women. But the resources are not enough. But in our small way, we do try to organize our women, educate them, tell them what it is to help them with the little that they have to empower them. So that is maybe the bit that we can do, some of us can do. Because anyway, sometimes too, we use our own resources to gather them or at functions provide little things for them. But it's not enough at all. So it's just come back to the education. That is all. And then the government partnership, and then with the NGOs, we can reach somewhere.
Okay, so I'm still going to still focus on you once more, because I mean, you've just talked about empowering them probably financially to be or economically, but how about probably domestic situations at home? How does the woman at the grassroots become assertive and be able to know her rights at home and all that, even educate her daughters on probably puberty and all that? I mean, traditionally, there are things that we've passed on from tradition to tradition. I mean, what are some of the things that you gather?
Okay, the issue is this, that times are changing. And this time, because of the so-called Christianity thing that has what dominated the nowadays system, you see, the people, like the puberty rights that you are taking, it doesn't happen again. They don't do it. Because even at the weekend, I was at home. When I called the young girls, because I try to talk to them, but the issue is that even some of them, they just don't want to hear about their puberty rights. They even don't want to hear it at all. Even their mother. Can you believe that even in my town right now, some members of some churches, when you call them for a forum, they will not come.
Well, maybe, I mean, you were talking about the seasons and times. Times have changed. Maybe it's hard time traditional leaders also modify the way they do things. Maybe it's not just about the ritual aspect, but probably educating them about hygiene, educating them about how to manage the home, educating them about how to even empower themselves if they probably find their talent, how they can harness it and all that. Do you engage the girls in?
We do. Like my place like this, I do a lot. I always engage them. I mean, I do a lot of programs in my town with especially with the support of Hope for Future Generation. We've done a lot in educating them, maybe nutritional-wise, health-wise, financial malaria. We did malaria. During the Ebola time, we organized them, talked to them, hand washing. In fact, we've been doing a lot. And I personally do it a lot, especially to educate them, like you are saying, in their homes, how to provide for their children, how to help. Even initially, I was even organizing a pregnancy school so that from the scratch, when the woman is pregnant, she knows what to do, where to go, the needs and everything. We do it. And even when it comes to, I help about some of the women, I even help personally to go to hospital. So that's what I was saying, that it's financial problem. Okay. A lot of them is financial
problem.
Yeah.
So, Madam Celia Seno, Hope for Future Generations, you say, is the convener of SDG 5. What is your role specifically in attaining that?
Okay, so our role is to mobilize civil society organizations to integrate SDG 5 indicators into their plan. Okay. You know, civil society look for their own resources. Yeah. And so if you get any small resources from anywhere, whatever you are doing, we have certain indicators, certain targets that are set. Okay. Ensure that...
Would you elaborate on it a bit?
Yeah, for example, responding or addressing all forms of violence against women, education, elimination of child trafficking, making sure that all women attain certain level of education, some of the SDGs. So whatever you have, integrate at least one SDG 5 target into your program. And that is what we do. The challenge is that you have to look for your own resources, because we are not giving any money by anybody. So
not even from the UN, because you are the convener for Ghana?
No, we don't have. We have our secretariat, SDG, the SDG secretariat being supported, but all the conveners, your organization must be committed to the target that you are, the goal that you are focused on, and integrate it into it. So what we do is, because Hope for Future Generation Agenda organization, we decided to host that and use our own resources to maintain it. We don't have the money to bring people together for conferences. What we have to do is to mobilize resources to do that. But I think basically what we try to do is to work with the traditional leaders, because the queen mothers especially are women. They are in charge of our social control. They are the people who have the voice. They can mobilize their subjects and communicate effectively to them. And so we work with community structures, the structures that exist. And so what we do is to empower them. One, they must know that they have their rights as women. They must know that their children, if today your child is well educated, then you are free tomorrow. Education can also reduce poverty, because if your child is educated and she's working, fine. We contribute to the government, the SDG reports. We participate and make sure that what is being written by Ghana is what is really happening in the country. We also come out with our shadow reports based on what we see on the ground, and come out with that. We do
and does this usually contradict what government present? Because you say shadow reports.
Yes, it's shadow. Mostly it's aligned with what government does, but there are certain gaps that we see because we are on the ground. And so we draw their attention to it, that if we contribute, if you do this, it will help us. So basically that is what we do. As civil society, as SDG, we are not the only, we have other co-conveners. WILDAF is a co-convener, and other organizations host the SDG with us. So we meet, discuss, plan, and see what we can do. When it's International Women's Day, we team up with Gender Ministry to ensure that these issues are addressed.
But I'm particularly interested in the fact that your activities are not funded. I mean, so then, aren't we shooting ourselves in the foot that we want to attain the SDG Goal 5, yet you are not provided the needed resources to pursue that?
I think that is a challenge we have. You know, civil society has its own challenges. Our president is one of the strongest advocates for gender, SDG 5, and the UN recognized Ghana's contribution. But stronger partnership with civil society is very important when it comes to that. We are not getting resources. I think this is where issues of women and girls must be one of the focus of our government. I know at that level it is, but when it comes to the implementation level, that is where we are not getting the resources. And I believe that if the government people, they are listening to this, they will know that this is the time to ensure that SDG 5, I know we have even the affirmative action coming up. We are struggling to pass it, and the affirmative action network is struggling. I heard the Speaker of Parliament at one of our meetings really pledging that they will make sure that the affirmative action bill is passed. A lot of women are struggling to ensure that we create that opportunity for women and girls. But it is time. We hope that this country will know that issues of women must be the center of most of the decisions that we make. And that is what we are.
So would you say that, this question goes to both of you, but would you say that then governments are not committed to achieving this? Probably we are just full of talk and do nothing. Maybe you could also just oppose that against where we have gotten to on the scale of probably 1 to 10, where we have gotten to in achieving the SDG goals.
You know, we have 17 goals.
Yes.
And we are supposed to achieve all the goals. Now, partnership is important, but the priorities, the government has its own priorities. We don't think that SDG 5 should not be the priority of this country. Look at the population of women and look at the population of men. Look at the number of women who are struggling to survive and take care of their families. I think it is important that we start looking at the gaps, because we realize that we have a lot of... when the MDGs came in, you saw that maternal health, we didn't do very well in achieving the maternal health goal and the MDGs. But for this one, the gender, which is goal 5, I know health, they are doing a lot in health, but where we have to put in a lot of resources to empower women, looking at gender equality and gender issues, is where we are lacking. Look at parliaments, how many women? Look at the appointments, how many women? And so you realize that women are assuming leadership role in this country. It's not easy. And even if you assume leadership role, it is not easy. You really receive what
you need to work extra hard or twice the effort too.
And that is it. And they will never, you will not get the support, because especially if you are a woman who can speak, you know your rights. A lot of people don't want you to. They want you to be the silent type and keep quiet.
Exactly. And I want to,
and it's not, that is our challenge.
And I want to add to that, even in the traditional setup, we women, we are finding it difficult, because you can't even stand up and do anything on your own. You must go to your... And the men, even sitting arrangement, they will tell you don't have a right to sit here. So it's difficult, because they put barriers in our ways.
But Mama, this has been an age-old tradition. What have you as women, have you come together to break that jinx?
Okay, like Madame is saying, when you are vocal, they know that you can talk. Like me, I find it difficult in my community, because at least I'm enlightened. I know my rights. So when you talk, I mean, they see you as a, what do I say, too known. And they intend give you names. And some of the men can go as long as to even, what do I say, pull me down, initiate some groups against you. It's happening. You see, so even
so apart from receiving some form of resources from CSOs to work with, you don't receive anything from governments? I mean, because the Ministry of Gender, for instance, and even at some point the First Lady had organized Queen Mothers to help in the efforts towards women empowerment in their localities.
They do, but sometimes I don't know what is really the barrier, because like Madam said, the resources, I don't know whether it's not enough, because like our council, we have a council of queens. We were able to visit the First Lady. We put our issues across. Till now, nothing has been heard. And then some other organizations, you can go there to ask for funding. But it depends. You can't really tell. It depends on how and who you know. Do you understand? Ghana has become a country of whom you know more than what you can do. So those are the difficulties. But we are trying our best, like with Madam, like they are helping a lot, especially to the hard to reach areas. They are really helping us. Even in the immunization sector.
I mean, they always say it's hard to reach areas, but some way, somehow, civil society is able to get there. So how does it not become hard to reach an area for civil society, but it is for government? I mean, you can tell me about the gaps you kind of identify.
You see, many civil society organizations, especially women-led organizations, are passionate about what they do.
Okay.
It is not the money. You understand? I can tell you, hope for future generations like this, money, we don't look at the money, but we look at the impact. We look at what we want to achieve as an organization. We look at the bigger picture, because our focus is women, girls, and children. So wherever they are, we go. Whether to cross a river, sit in a boat, we do it. And a number of women-led organizations are so passionate. The problem is that you will not get the resources to work. They are hard to reach because some of these areas, in fact, in their traditional, we did a number of programs in their communities. If you see where people come from for immunization, you will weep. How number of miles they will work. They will walk before getting immunization. So from our own resources, we have to build shelters. We have to provide motorbikes. We have to support them so that the women with their children can have access. And so I know the government is doing their best. But what drives some of us in the NGO sector is not the money, is the passion to make a change, to make a difference. And that is what many of us stand for. That is why Queen Mothers, because we believe that working with Queen Mothers, you can reach every corner of the country, because they are there. And so across all the regions that we work, Queen Mothers are the people we work with. And we continue using them, because using their strategy, you're working with them, you are sure that your activities and your interventions are sustainable.
Let's get into some of the works you've been doing in these hard-to-reach areas. I mean, you've mentioned the fact that you've supported them with the creation of shelters so that it will cut down their journey for immunization. What are some of the works that you do as a women-led organization?
Okay. So, for example, HFFG, we are 20 years now. From the day we started, our working with women has yielded a lot of results. One, addressing maternal health we make sure that we build the capacity of women on danger signs of pregnancy, the whole safe motherhood, to reduce maternal and child mortality. We work with Queen Mothers in many of them. This is Ashanti region Queen Mothers. We did reproductive health. We do cervical cancer screening to ensure that a lot of women, a lot of girls, they have the pre-cancer. If you have the pre-cancer, we link you to treatment. We train these women to ensure that they are on their own. But partnership is very important when you want to develop and go far. We partner other organizations, Solidaridad, Simavi, with other partners to do village savings, so the women mobilize their own resources, made a lot of money to support their husbands and to to improve their economic empowerment.
Okay, so I see some of your activities being projected on the screens. If you could just tell us where these areas are.
Okay.
And
this is in Ashanti Western region. That is a woman. She has just collected her share of so much money
from the cocoa.
From the village savings.
Okay.
This is empowerment. This was in partnership with GIZ, empowerment of women in the informal sector to contribute to tax.
Okay.
And so we empower them, because it's the tax that they contribute that help us to achieve, for the government to develop what we want to see. If you see some of the programs, this one, it was Gender Ministry who gave us the award. We received it last year during the International Women's Day for recognizing our contribution to HIV in Ghana. Hope for Future, in partnership with Society for Women and other NGOs, mobilized women living with HIV in Ghana. We train them, we empower them to attain leadership. We mobilize young ones living with HIV. So most of our programs are in partnership with other organizations. We encourage people to work together. This project like this, the Bato Government Catholic Hospital is one of the one of the institutions that support train people for cervical cancer screening. So we supported a number of nurses to the Bato Catholic Hospital for training to support our cervical cancer screening center, and we donated a number of equipment to support Batoje because they are doing a lot of work for women. It's a Catholic institution, and they screen women pre-cancer cells. The doctors there, the nurses there, make sure that they cure them out of cancer. Cancer, if detected early, cervical cancer, you are cured, and that is what Bato. So we partner Bato Hospital to ensure that we go to the villages, screen women, girls for pre-cancer cells, and refer them for treatment.
So, Mama G3, in all his Madam Seno's submissions, she made mention of the fact that they depend massively on your support to get to the grassroots. And I also believe that as a woman, you wield such authority over the men. I mean, if you know how to get your way around the men, you could always get things done. Have you, as traditional women leaders, tried in your own way to lobby the men to...
We do.
Okay.
Like I was saying, let me differentiate. When you have the king who is well educated, like my paramount chief, we don't have problem with him. But it boils down to, excuse me to say, those who
the sub-chiefs.
The sub-chiefs, some of them really don't understand the leadership rules and things like that, or how to work together. It's like they will tell you tradition doesn't permit women to do some things, or to be in association with the kings to do some things. This is but this time it's with the kings that are well educated and well exposed. They don't do that. So those are the problems. So it still comes down to education. That is what I am feeling is lacking. When they understand, they are educated, or capacity building. This is what I will say. When we are able to build, or we get funding to build the capacity of the kings, the sub-chiefs, and then maybe the chairmen and things, they will also come on board. Because as for my paramount chief, you don't have a problem unless he's not there. But if he is there, he knows what to do. You don't find it difficult at all approaching him. So those are the things. So it's let me say ignorance. Please, a major part.
Okay, so Madam Seno, I mean, she has also made mention of the fact that even traditionally as women leaders, they are kind of stifled because they don't have the capacity to even pursue their own dreams and goals. What do you do as an organization for these leaders before they even get to the grassroots levels?
Okay. So thank you for such things. We try to empower them for them to know their rights. We ensure that partnership. And one thing we also do as an organization is male involvement. Because you can never do it without the men. And if the men wants to come together to pull you down, I'm telling you that they can do it. And they will use women to pull you down. Because there are women who don't know whether they are here or here. And so we try to mobilize them. We try to dialogue.
And they will say lobby. They will lobby them.
Lobby. We try to do a lot of... And then also, you see, what women have their role. Men have their role. But when you bring these two roles together, you realize that we all achieve one goal. And that is developing your community. That is what we try to do.
So I'd like you to hold your breath, and so that I can announce the WhatsApp lines that we have. So viewers can join in the discussion. Today we are talking about the role of women-led NGOs in attaining the Sustainable Development Goal 5. that talks about empowering women and girls. So the numbers to WhatsApp us on is 025, I beg your pardon, 055 744 6429, 055 744 6429. And the numbers to call if you want to participate in the conversation is 0260 969 160, 0260 969 160. Okay, so we are told you're 20 years old. I mean, you've been doing this over the last 20 years. Can you tell us the journey so far in the last 20 years?
Yeah. So it has not been easy. Women leading civil society in Ghana is very difficult. You get your part of the abuses, and you know they can easily call women witches because you want to make an impact. And making impact is where people find it difficult. You know, many of the communities, you know, they are in their own world, and you are coming in with your program. So you must plan with them, you must get them involved, you must partner them. When you partner them, you will achieve your goal. But it's not all of them that will follow what the education or what you expect. You will definitely, you might get about 20% or 50%. So they are educated, they get the information, but the resources to implement some of them is very, very difficult. For example, if you teach women nutrition, balanced diet, they plant most of them in their community. They have access to it, but the protein part is not there. So you end up seeing them taking more carbohydrate, and then the problem that you don't want to see, you see it. Apart from that, there's so much abuse, you know, violence in the communities. Women are still relegated to the background. I mean, the voice of women is not there. You can talk, but who will listen to you? So you see that women empowerment is still a problem. Another challenge that we see in the community is that there is stronger partnership with the health sector. We work a lot with district health directorates and district assembly. The resources for the district to implement some of the activities is difficult. Even though we have resources, some of the resources at the national level, but district, regional level, district level resources to work with is not adequate. So if you give education, you tell people, you tell people go to hospital when you have this condition, you go there and the health, the district or the facility tells you, oh, we don't have this today, this resources, go here, it's a problem. You know, national health insurance is there. It's supporting people, but it's not everything that you can really get when you go to the facility. So I think that what we have to start looking at is more resources into preventive health, and give more education to ensure that people don't fall sick. One important thing, civil society coming together to work is very important. Partnerships are very important. And so we must really look at that. But women, girls, in fact, we have been in Central, we started from Central region. Teenage pregnancy has been and is still a problem in the Central region. Some of the communities, you go there, the children, you see them in school, all right. By the time they write their BEC, a number of girls drop out already because they are pregnant. Who is impregnating these girls? If you go through, many of them are adults. Many of the people impregnating these poor girls are adult men. And I think you talk about it, but the family is not prepared to talk about it. It's like they want to settle it. And this is where stronger partnership with traditional leaders is very important. Because if the girls continue getting pregnant, where is our future as a country? And I think this is one of the campaigns that we want to look at. When you talk about sanitary pads, a lot of people cannot afford it. And so if you come and sleep with me and I give you 5 CDs to buy pad, then I get pregnant, where is it? So you see that basic needs of women and girls really put them into trouble. And that is where we get a lot of pregnant young ones. And teenage pregnancy is rising. So you see poverty among women, poverty among youth. A lot of them are there doing nothing. And so the next thing is the social problems, vices. They are easily led into a lot of problems. So I think those are the challenges. I think maternal health is gradually reducing. We thank God, we thank Ghana Health Service and Ministry of Health for doing the campaign. But we still think that they should form stronger partnership with civil society, with traditional leaders, to ensure that maternal mortality is reduced to the minimum. Pregnancy of our young girls should be something we should address, and it's still a challenge for us as a country.
I mean, since the examples you cited, their needs are like a cyclical thing. So
and basic.
And okay, so they might be basic and cyclical, but so do you think then that you're making any gains at all? Are you gaining any grounds at all? Because it's like you start something and one needs leads to another, and then you come back to ground zero. So I mean, are you making any gains?
We are making a lot of gain. We can't do it all, even though we work in all the regions, but we don't work in all the districts. So if you see the and in fact, the certain civil society funding is time. If someone gives you money for 1 year, what can you do 1 year?
Don't you have access to the Global Fund?
No, you have access to it. It's still funding. Global Fund is funding. When Global Fund gives you money for 3 years, another 3 years you have to wait when the money finishes. So I think it is time government start looking at civil society funding. If I say civil society, not just NGOs, traditional leaders, faith-based organizations, and start. You see, East Africa is coming out with a strategy where government will plan that you are a civil society that we can trust, you will achieve results. So we'll give you a certain number of districts, we sign contract with you, we give you targets to achieve, we give you resources, achieve those targets within 4 years. And you show them the result. If government can start engaging civil society on that part, I think we will move forward. Because it's not a competition. We should look at partnership. There's so much civil society organization. There are so many women groups. Look at Net Rights. Look at Abantu for Development. World Health. I mean, these are organizations, FIDA, government can partner. Hope for Future Generation, there's an organization, Social Serve, West Africa. These are very, very credible organizations and coalitions that government can use to achieve a lot of it. It's just saying that, no, let me agree with you. I'm giving you this target. I'll give you these resources. Take charge of maybe 10 regions or 10 districts. Achieve this within 2 years or 3 years. Work with traditional leaders, work with youth groups, blah, blah. We have the strategy, we have the innovation. It's the resources that we don't have. That is why we are there wasting. But the little that we have as an organization, we have made a lot of impact. And they can testify.
Then, if I may come in again.
Yes, go ahead.
The hindrance too is there that human rights issues are a border too. Though some are good, some are also hindering us as traditional leaders. Because gone are the days whereby something could happen, or you can just reprimand somebody's child, and they will take it in good faith. But this time around, if you don't take time and you do it, even a human rights activist can just engineer and say they should go to court. You see, those are also impediments in our way. So you are careful at what to do, because somebody's child maybe is wearing a dress, you see, maybe up to this place, you talk about it, they will come and tell you, this is what I have, and my child, what right have you? You see, so those things too are what hindering us. This human right is good in a way, but too much of faith is, because even gone are the days you can even be caned in the a chief's palace, and nobody cares. But this time you try and see. You can't even do it. You can't even think about it this time. You see, so, and even like I heard something on air and it was pathetic. Somebody did something, called to the chief's house, and a human rights activist was advising the person that you just send some bottle of snaps, go and tell the chief, okay, I've come, but I want it settled at the court. So what do we do? You see, so when these things get to the people, everybody will say, I'll go to court. Do you understand?
Okay.
So you sort of hinder our progress. So there's a lot.
Okay, so but you have mentioned the fact that Hope for Future Generations has engaged you on a number of platforms, especially in maternal health and all that. But there are some other factors that also impact on a woman's health, a woman's economic empowerment. What are some of the activities that you have engaged in? I mean, if you can just recall some of the activities and how they came of help to you.
Okay, like, excuse me.
Before you go, before you make your submission, I understand there's a caller on the line. Hello, good afternoon. Hello, good afternoon. Hello.
Hello.
I believe, hello.
Hello, good afternoon.
Good afternoon, ma'am. You're welcome to Women's Voice. Your name and where you're calling from.
My name is Priscilla, and I'm calling from Aoshi.
All right. What would you want to say concerning our topic of discussion?
Okay. I just wanted to say I'm really motivated by the gusto with which the executive director is speaking with. It really shows that women are doing a lot in the country, and I like the way she contributes about how civil society can help to ensure that the nation develops in all sectors as well. And I just want to congratulate them on the good work that they are doing. It's really amazing to see that civil societies are active in the country. And I just want to say that may God bless their good work and may they continue to do what they do.
Are you a beneficiary? Are you a beneficiary of any?
Yes.
Okay, so would you like to share with us?
Pardon?
Would you like to share with us what you've benefited from civil society groups?
Oh, okay. With pertaining to the benefits I've received a lot of training from them, both psychosocially and in terms of peer education. And they also are taking volunteers, and I've been a volunteer with them before, so I've actually gotten to experience the work they do, and it's given me a chance to grow. So yes, these are the benefits I've experienced from them.
That's really encouraging to hear, because I mean it means that your efforts are not going waste. At least you've made some impact. Okay, so let's talk about Hope for Future Generations in the next 2 decades. I mean, you've chalked 20 years, so you're a score old. So let's see, how about the next score? What are we looking at?
Yes, so the 20 years we say is just a foundation to help us take off now fully. Our focus will not change on women, girls, and children. They are the target that we work with, because we believe that working with women, working with families ensures a very sustainable country for us. So we are looking more at partnerships now, because we realize that the gaps are very wide. A lot has to be achieved. No one organization can do it, so we are looking at stronger partnership, a formalized partnership with institutions, with media, because you are very powerful, you are everywhere. Traditional leaders still remain our stronger pillar when it comes to community structures. But youth, you know, the person who spoke is a young person. If we want to move this country forward, young people should not be left behind. Because if we leave them behind today, tomorrow, the gap will continue increasing. And so we will work strongly, very well with young people and empower them so that their education become the priority for us. We encourage them. We want to really ensure that we sustain our achievements, and then make sure that we focus on the reproductive health area, empower women. We are looking at ourselves as an organization that can mobilize resources and then get other younger, smaller organizations on board to implement at community level. I mean, that is where the problem is. It's not at the national level. policies are developed here, but policies are implemented at the grassroots. And so our focus will still be at the grassroots, whilst we are looking at advocacy at the national level.
Okay. So Mama G3, before the caller came through, you were going to make some submission about the activities that probably has projected your community a notch higher.
Okay. We partner with them to help the community. And again, they have this, like you say, self-help
Village savings.
Village savings
Mobilizing
that they do that. And then I also work with an NGO who is into agric. Right now, even as I speak, they've given us a tractor who is plowing for them in the village. So this is some things we are doing to help the women.
Do you still have access to lands and credit facilities?
Oh, as for the lands, you know, in our villages, we don't have much issue with land, because lands are for individuals and then clans. So per se, we normally don't have land issues as a major this thing.
Okay, so I mean, she has mentioned some of the things they would want to embark on in the next 20 years. Since your partnership with Hope for Future Generations has not seeded yet, what would you want to see done in your community?
Okay, health. Like in my community is health. The health center. You
don't have hospitals?
We have a health center, like I'm saying, but it's not well equipped. That's a major aspect. The district hospital, they don't have enough equipment. Those are the hindrances, because somebody maybe who doesn't even have the money, when the person comes to hospital, the person is referred again, who cannot even provide maybe 50 Ghana, is now referred. He has to pay for the ambulance, have to pay for the hospital bills, which may even run 2,000 or 500 at home. So those are the things the government, I will appeal. The government see to equipping
the district hospitals.
So that the district hospitals and then the health centers must be equipped, so that at least we can.
So we are about to wrap up our conversation because our time is up. So I want you to probably share your final words with us.
Yeah.
And then
I think I am just calling on. Yes.
If you have any submissions, go ahead before she wraps up. Yeah.
Okay. So
yeah, go ahead. Please.
Okay. My biggest appeal to government is that they should at least meet the budget of health services, and especially the vaccines. They should vaccines for immunization must be catered for by the government. It should make an effort to do that for us, because when the children are healthy, their parents will be free and they can go about their duties and then maybe find money for the upkeep of their children. But when they are sick, I think, and even when they do that, we'll build a healthy nation. So immunization is our priority. Yeah.
So I just want to say that partnership is very important. Government is partnering different donors, but it's also important that Ghana also meets its co-funding, because one day these donors will all leave. The problem we have here, they also have it. So the government should really, really ensure that resources are put there to sustain and to ensure that our health is catered for. And stronger partnership with communities, civil society is very important. Faith-based organizations, NGOs, traditional leaders, youth groups. I think that is the only way we can achieve our goal at the grassroots level.
Okay, so for me, my take home would be that you've mentioned partnership, but key to attaining these SDG 5 is funding of women-led activities.
Yeah.
So I would want to, before we part ways, I would want to leave viewers with this quote by Maya Angelou. She said, each time a woman stands up for herself, without knowing it, possibly without claiming it, she stands up for all women. And I believe that's what Mama G3 and the Hope for Future Generations have been doing in our community, not standing up for just themselves, but all other women in the or at the grassroots levels. Well, viewers, it's been another hour, and we've been discussing the role of women-led NGOs in attaining the SDG Goal 5, which is about empowering women and girls so that they can have the capacity to pursue their dreams, they can have access, they can be assertive and know their rights. And that's what we've been doing today. My guests have been Madame Cecilia Seno, and she is the Executive Director for Hope for Future Generations, and they have been at the grassroots level leading women empowerment efforts. And seated next to me is Mama Jitri. I'll try to mention your surname, Novitowo. Novitowo. And she's the Queen Mother of Uri Agoviefa. Okay, so I did my best, didn't I? Anyway.
Well done.
So, well, viewers, it's been another hour of discussions, and we hope to see you same time next week. Bye-bye.
Tokyo has the Olympics. Join us, GT Sports Plus, for all the action from the athletes. July 23rd to August 8th, 2021.
Now starting to pull away. There she goes! Katie Ledecky smashes her own world record. Nobody doesn't like Simone. This has been her destiny all along. Emmanuel is going to do it! Oh! Caleb Dressel at the wall gets it done!
GT Sports Plus, the legends live here. This program is proudly sponsored by Betboro.
Hello, as you're all aware.